AAPC CPC Final Exam Real Exam with 150. Questions and correct answers verified. Answers a guard. What form is used to submit a provider's charge to the insurance carrier? A. UB-04. B. Provider reimbursement form. C. CMS-1500. D. ABN. Answer C. CMS-1500. Which coding manuals do outpatient coders focus on learning? A. CPT, HCPCS Level II, and ICD-10 CM. B. CPT and ICD-10 CM. C. ICD-10 CM and ICD-10 PCS. D. CPT, HCPCS Level II, ICD-10 CM, ICD-10 PCS. Answer A. CPT, HCPCS Level II, and ICD-10 CM. In what year was HITECH enacted as part of the American Recovery and Reinvestment Act? A. 2010. B. 2009. C. 2000. D. 2007. Answer B. 2009. Voluntary compliance programs also provide benefits by not only helping to prevent erroneous or _____, but also by showing that the provider practice is making additional good faith efforts to submit claims appropriately. A. Overutilized codes. B. Duplicative claims. C. Fraudulent claims. D. Mistaken principles. Answer C. Fraudulent claims. 1/4. Which CMS product describes whether specific medical items, services, treatment procedures, or technologies are considered medically necessary under Medicare? A. Medicare Claims Processing Manual. B. National Coverage Determinations Manual. C. Relative Value Files. D. Medicare Physician Fee Schedule Final Rule. Answer B. National Coverage Determinations Manual. Which condition results from an injury to the head? The symptoms include headache, dizziness, and vomiting. A. Meningitis. B. Concussion. C. Epilepsy. D. Parkinson's disease. Answer B. Concussion. In order, starting with the innermost layer, what are the four walls of the digestive tract? A. Mucosa, submucosa, muscle, serosa. B. Serosa, mucosa, submucosa, muscle. C. Mucosa, submucosa, serosa, muscle. D. Muscle, submucosa, mucosa, serosa. Answer A. Mucosa, submucosa, muscle, serosa. Which one of the following best describes psoriasis? A. A chronic condition characterized by red, dry, elevated lesions covered by silvery scales. B. An inflammatory condition characterized by redness, pustular and vesicular lesions, crusts, and scales. C. An allergic reaction characterized by wheals and generally accompanied by pruritus. D. A contagious infection of skin generally caused by Staphylococcus bacterium. Answer A. A. Chronic condition characterized by red, dry, elevated lesions covered by silvery scales. A form of milk produced the first few days after giving birth is A. Prolactin. 2/4. B. Colostrum. C. Lactose. D. Corian. Answer B. Colostrum. A condition where the thyroid is overactive is called A. Thyrotoxicosis. B. Panhypopiturism. C. Ketosis. D. Thyroiditis. Answer A. Thyrotoxicosis. What do the instructions and conventions of the classification take precedence over? A. CPT. B. Documentation. C. Official coding guidelines. D. Nothing. They are only used in the event of no other instruction. Answer C. Official coding guidelines. What is the sequencing order when coding a sequela late effect? A. The symptom is coded first, followed by the residual condition and the late effect code. B. The cause of the late effect is coded first and the residual condition is coded second. C. The cause of the late effect is coded first. The residual condition is second, followed by the symptoms. D. The residual condition is coded first, and the code S for the cause of the late effect are coded as secondary. Answer D. The residual condition is coded first, and the code S for the cause of the late effect are coded as secondary. Using the ICD-10 CM alphabetic index, which main term below has an instructional note indicating. Another main term may also be referenced that may provide additional alphabetic index entries that may be useful. A. Diabetes. B. Fibrosarcoma. C. Appendicitis. 3/4. D. Symptoms. Answer B. Fibrosarcoma. A 50-year-old female presents to her provider with symptoms of insomnia and upset stomach. The provider suspects she is premenopausal. She is diagnosed with impending menopause. What diagnosis codes should be reported? A. E28.319. B. G47.00 K30. C. N95.9 G47.00 K30. D. N95.9. Answer B. G47.00 K30. Rationale. ICD-10 CM Guideline I.B.11 states to reference the ICD-10 CM alphabetic index to determine if the condition has a subentry for impending or threatened, and also reference main term entries for impending and threatened. If the subterms are listed, assign the given code. If the subterms are not listed, code the existing underlying conditions and not the condition described as impending or threatened. Look in the alphabetic index for impending. There is not a subterm for menopause. Therefore, the S symptoms are coded. Look for insomnia, organic, which directs the coder to G47.00. Next, look for upset/stomach, which directs the coder to K30. Verify code selection in the tabular list. What is the ICD-10 CM code for a laceration on the left shoulder, subsequent encounter? A. S51.009D. B. S46.001D. C. S51.801D. D. S41.012D. Answer D. S41.012D. According to ICD-10 CM guidelines, when a patient is seen for management of anemia due to malignancy, how is it reported? A. Anemia is reported first, followed by the code for the malignancy. B. The malignancy is the only condition reported. C. Anemia is the only condition reported. D. The malignancy is reported first, followed by the code for the anemia. Answer D. The malignancy is reported first, followed by the code for the anemia. Powered by TCPDF, www.tcpdf.org/4.